All right, good morning, Aussemon. Thanks for joining today. I'm going to go ahead and introduce myself. I'm Megan, a pharmacist with Walmart. Would you like to introduce yourself as well?
Yeah, thanks. So I'm Aussemon and also a pharmacist with Walmart and excited to be here and talk with you today.
Definitely, yeah. So as we all know, this past year has brought many challenges around everyday life. So I want to just take some time and ask some questions around how COVID-19 has impacted those with diabetes and other chronic disease states. So are those living with diabetes at any greater risk for complications from the virus?
You know, Megan, this question has actually come up a lot over the last year from patients. Data has shown that older people and people living with pre-existing medical conditions like diabetes are more likely to develop severe complications from the COVID infection. It's not that they're necessarily more likely to get the virus, but that they're more likely to have severe symptoms or illness if they get the virus. But this is the same with any other virus, right? So when someone living with diabetes gets a viral infection, they're more likely to have severe symptoms or complications. On that same thought, people who are already experiencing complications or other health problems from diabetes are more likely to have worse outcomes than people who are diabetic but maybe otherwise unhealthy.
Oh, gotcha. That makes sense. So really our patients with diabetes have to take extra precautions to make sure they're staying safe during this time. So what are some ways that everyone can continue to stay safe while the COVID vaccines are being rolled out?
So the CDC has released a lot of guidance around ways to stay safe, whether you've received your COVID vaccine or not. Some of these include washing your hands regularly or using hand sanitizer if hand washing is not readily accessible. Also want to try to avoid touching your face. I know this one can be really tricky right now while we're all wearing masks. And as always, you shouldn't share drinking glasses or food. Again, these are all standard best practices for everyday life to help kind of decrease your risk and exposure to any virus, not just COVID-19. This next one gets missed a lot, but make sure you wipe down and disinfect any surfaces that are touched frequently. So I'm thinking doorknobs, cell phones, steering wheels, those kinds of objects. As far as like lifestyle changes go, think about what you may be able to avoid during this time to help protect yourself and your family. So large gatherings like concerts, restaurants, and bars, or maybe any unnecessary travel. We know that life can't stop, right? So minimizing your exposure to other people will help. So if you're used to going to the grocery store, say 3 times a week, maybe you can try to plan ahead, make one big trip instead of multiple trips. Or even better, so many companies are offering delivery now, whether that's groceries or restaurant orders. A lot of companies have moved into offering delivery to help decrease your exposure to the public. So I know at Walmart, we have multiple options available to help our customers. So you can pick up groceries at the store without even getting out of your car using our online grocery pickup. Or you can have your groceries delivered straight to your doorstep using Walmart Plus. So some of these pickup options are even free. So make sure you take advantage of these options if a retailer or restaurant offers it. But Megan, the most important one of all is if you don't feel well, you've got flu-like symptoms, stay home. Whether it's the flu, COVID, or any other viral infection, it's important that you stay home to help prevent the spread of the infection to your friends, family members, and community. You need your rest so you can get to feeling 100% again. I also think it's important to also point out one other thing here, and that's when we'll never know if we're going to start feeling sick, right? We don't know when that time's going to come. We don't know when we may start coming down with something. So it's important for everyone, but especially people with diabetes, to make sure they're planning ahead in case something happens. Make sure you have enough medication on hand for at least a couple of weeks in case you have to quarantine yourself. Make sure you have enough testing supplies on hand so you can check your blood sugars. So I think that part is really important to think about and be proactive.
Definitely, definitely. Thank you. So those are some great tips on staying safe and prepared for anything that might come up. I love that reminder to sanitize our phones, right? So let's talk about the vaccine. Why is it important for people living with diabetes to receive that COVID vaccine?
So this goes back to the first question around diabetics being at an increased risk for complications or severe infection with COVID-19. We know that the severity of COVID-19 can be much greater in someone that has underlying health conditions. So thinking about diabetes, heart disease, COPD, amongst many others. So it's especially important that these people get vaccinated. If you look at the vaccine data, the efficacy rates are really, really good at preventing infection, but they're even better at preventing hospitalization from severe infection. Ultimately, that's what we're trying to prevent. We're trying to prevent losing loved ones to COVID-19. We realize there's still a possibility of getting the infection after getting vaccinated, but the vaccine will help prevent those severe complications that come with the infection that could potentially lead to death. And that's why it's so important to get vaccinated, especially in those vulnerable populations, such as the elderly or those living with underlying health conditions like diabetes.
Got it, got it. So thankfully, there's many places to go get vaccinated now, right? I know with Walmart, you can log into walmart.com/COVID vaccine and check for available appointments at your local Walmart pharmacy. So what other vaccines should those living with diabetes consider?
I love this question. So it's so important that people living with diabetes stay up to date on their vaccines and consistently ask their pharmacist or doctors if they're due for any boosters or new immunizations. Especially now, we've gone through this period of time where we weren't going to see our doctors regularly. We weren't staying up to date on routine vaccines. We've been using video chat and phones to communicate our health needs and concerns. You may not realize this, but pharmacies have stayed open through COVID and offer a variety of vaccines to our patients. So I encourage you to stop by your pharmacy and ask your pharmacist what vaccines they recommend for you. Whether you're diabetic, have other health conditions, or just simply you're curious. For my patients living with diabetes, the vaccines that first come to mind are the annual flu shot, the pneumonia vaccines, and the COVID vaccine. I would also recommend a tetanus shot if it's been over 10 years since they've received one, the hepatitis A and B series, varicella series, and a zoster vaccine like Shingrix if they're over 50. I know it sounds like a lot, but having to get a few shots surely outweighs the risk that comes along with developing complications from some of these preventable diseases.
Yeah, I totally agree. Getting a few immunizations is definitely better than contracting pneumonia, shingles, or those other diseases you mentioned. Thanks for providing us with all this important information. I know everyone's definitely going to find it helpful. I really appreciate your time today, Aussemon. Thanks for chatting with me, and I hope you have an awesome day.
Thanks, you too. Bye.
Bye-bye.